Sorry guys, we delayed it because he's just come in. I could see him. I saw him over here. Alright, we're going to take a look at College of American Pathologists Accreditation Part 2. Alright? Let's go. Alright, so this is total quality management. So you've got T is for the roof, the foundation, and the building blocks. Okay? Management will deal with that. So we asked the question, what is quality management? A dynamic quality management program, QMP, enhances any and all activities that impact patient care, promoting quality and patient safety through risk reductions and continuous improvements. Lab director and supervisor are responsible for its implementation, and you will see how important the lab director is. It was there in the last presentation also. A laboratory must have written and implemented QMP plan specific to the laboratory that includes all disciplines of the laboratory. I told you everything is included, you can't skip anything. All inherent processes, including quality control, assurance, and improvement, operating on a continuous basis to provide quality patient care. A quality process that pre-analytical, analytic, and post-analytical phases of laboratory QMP requires a set work, a system for monitoring these processes, which must include a set of metrics or monitor key indicators for pre-analytical, analytic, and post-analytical phases of testing and patient safety. Alright, this continues. So the core process deals with the pre-analytical, analytical, and post-analytical. The pre-analytical process it deals with test, what is it? Can you read it properly? Specimen collection, specimen, and can you enlarge it by any chance?
No, it's black.
The analytical process, of course, you've seen a lot of pre-analytical PPTs. The analytical process deals with testing, the actual process, and so on. Post-analytical process deals with results which are coming out, result reporting. Alright? So for each key indicator, the laboratory must specify criteria of acceptance, data collection, analysis and evaluation, frequency of review. So this is pre-analytical, analytical, and post-analytical. Annual evaluation of effectiveness, measurement of patient and of physician satisfaction. Little feedback that comes from both ways. A documented quality control system. And evidence quality control has been reviewed. It has to be initial, it has to be studied. Internal and external communication of quality management outcomes. A process improvement system which must include review of errors, complaints, and incidents. This we have in NABL also, when the patient has a problem, writes down the complaints and we have to solve it. Identification, implementation of corrective action, again parts of your NABL. And infrastructure for the quality management system, including aspects such as a document control system.
She's joining.
We'll continue. Alright, let's go further. Okay, in the next slide, we are taking a look at, for each key indicator, the laboratory must specify criteria of acceptance, data collection, analyses, and evaluation. See how thorough they are. Frequency of review, measurement of patient and of physician satisfaction, a document quality control system, and evidence quality control has been reviewed. Everything has to be initialed and dated. internal and external communication of quality management outcomes, a process improvement system which must include review of errors, complaints, and incidents, identification and implementation of corrective action, an infrastructure for the quality management system, including aspects such as a document control system. Is she on?
Yes, ma'am.
All right, let's go further. We've done this.
Yes.
All right, we continue. So the laboratory benefits, if all this is followed, laboratory benefits as under. Continually ensuring that practice matches policies and procedures. So what you have written, you must do, and you must do what is written. Providing opportunities for quality improvement, improving patient and or clinical satisfaction, the clinician satisfaction, maintaining ongoing compliance with CAP requirements. So whatever CAP requires, we have to give them what is required. If not, we are in trouble. So of course, we're coming back to internal and external quality control, why and how. A quality assurance program that enables laboratories to evaluate their performance. You remember the difference between quality assurance and quality control. Outline what is proficiency testing and why do we do it? Who does it and how often? How is it evaluated? What do results mean? What happens when we fail? How to investigate the PT. External quality assurance EQA, also known as proficiency testing, is a key indicator for laboratory quality control on an ongoing basis. Who is responsible? The lab director. Each CAP accredited laboratory must be enrolled in CAP PT EQA under its own assigned CAP number. PT EQA is an external quality assurance program that uses unknown samples and allows laboratories to compare their own testing results with other laboratories using the same and similar instruments or methods. This is very similar to what we had in NABL. Okay? The PT EQA program regularly sends specimens for testing. So I told you that is the difference. They send you samples every month depending on what you ask for. It's not like for NABL the samples for the whole year are sent in a batch, okay? Especially in biochemistry. The laboratory sends the results back to PT EQA program for evaluation and then receives the performance report and summary. To determine which testing requires enrollment for PT EQA, the laboratory can refer to quote request form, because they've got all these different forms. I'll tell you what they do. Additional information is available in CAP surveys and Excel catalogs. So this is their part of the external quality assurance program, surveys. Country requirements. The laboratory should be familiar with its country's requirements, including customs and importation, and documents required to import PT EQA samples. Because right now they are sitting in America, we are in India, and what is applicable to us we should know and send the same requirements back to America. Import permits are obtained by the laboratory and forwarded to the CAP to be included with PT EQA shipments. See, that's most important. The laboratory may also need to provide these documents to brokers or landing shipping office. Okay? Continue. Laboratory should work with local authorities to determine if any permits are required, and this is important. Otherwise, our samples are held up in between. Use of order descriptions in the CAP PT EQA catalogs will prevent discrepancies in permit preparation and customs clearance documents. Orders will not ship without required documentation. The laboratory is responsible for monitoring permit expiration dates and submitting new permits. Permits should be submitted at the time of ordering or at least 6 weeks prior to the stated order ship date to ensure on-time deliveries. Look at the details they give you. Benefits. Laboratory benefits include ensuring quality of laboratory testing, maintaining ongoing compliance with CAP requirements. So they are very thorough. Everything with them is legal and above board. You cannot hide anything. And if something is not there with you, they will tell you, please get these permits. And so you've got the contact center at cap.org. You can ask them questions and you have a telephone number. So CAP evaluation, what should you review? Evaluate each analyte and specimen for negative, positive, bias, trends or shifts. Evaluate upgraded challenges. So you have to keep reading. You have to know what's happening in the current scenario. Initiate corrective actions. Prove accuracy and precision of method. Recalibration. Procedural update. Survey material handling and processing. But this is where your quality control comes from. External quality control comes from. Retraining if needed. New methods and instrumentation. You have to know that. And you have to tell them that if you change your instrument, this is what we have. Acceptable payment forms include, now see, they're giving you all the details because this is an international problem, right? Check, make payable to College of American Pathologists in US dollars. Credit card include number, expedition, card holder's name, and authorized signature. Purchase order. A purchase order indicates a future commitment to pay using a purchase order number. Letter of authorization include a signed letter of authorization on your institution's letterhead if your institution does not use a purchase order system. Wire transfer include all bank fees with your payment. The CAP is not responsible for bank fees incurred while remitting payment. Once the transfer is complete, notify the CAP at the addresses there. Remit wire transfer payment to BMO office Harris Bank, that is the bank, and that address is given to you with a telephone number. Quote request, if your organization requires a quote pro forma invoice prior to payment, please notify, and it's contact center, blah blah blah, they give you details. Alright? Now this is your order form. Numbers, etc. So there are steps to follow once the order is placed. Please read details in the CAP Lab accreditation brochure. It has to be followed exactly the way they want to do. Alright? Standard for NABL, the book ISO 15189 2012 was a book that all labs use. Now, of course, now we've got 22. The NABL standard has 3 main sections dealing with definitions, management, and technical sections. Now we know that we have up to 8 different sections and subsections. This in turn will give rise to various documents like quality management, quality procedure manual, SOPs, etc. CAP also follows 15189, that is the advantage, together with CLIA 88 guidelines, which are compulsory. 15189 is optional together with CLIA. They give you the option. The CAP standard has 4 main divisions. So what is a standard? A standard is a guide document to the state of the art in a specific discipline or technical area developed through expert consensus. It can be thought as a set of best practices that an organization agrees to adopt and live by. Standards set forth requirements that an organization must meet. Standards do not have the force of law except in those countries that incorporate the requirement into national law. Now that is a different section. Some countries do. So we asked the question, what is CLIA? And I gave it to you before. Clinical Lab Improvement Amendment, CLIA, of 1988, are United States federal regulatory standards that apply to all clinical laboratory testing performed on humans in the United States, except clinical trials and basic research. So get familiar with the name. Clinical Laboratory Improvement Amendments of 88. CLIA program. In accord to CLIA, the CLIA program sets standards and issues certificates for clinical laboratory testing. CLIA defines a clinical laboratory as any facility that performs laboratory testing on specimens derived from human for the purpose of providing information for diagnosis, prevention, or treatment of disease or impairment, health assessments. An objective of the CLIA is to ensure the accuracy, reliability, and timeliness of test results, regardless of where the test was performed. Per CLIA, each specific laboratory system assay examination is graded for levels of complexity by assigning scores of 1, 2, 3 for each of the following 7 criteria. Score 1 is the lowest level of complexity, and a score of 3 indicates the highest level. Score 2 is assigned when the characteristics of a particular test are intermediate between the description listed for scores 1 and 3. Criteria of categorization: knowledge, training and expertise, reagents and material preparation, characteristics of operation steps, calibration, quality control, and proficiency testing materials. Test systems, troubleshooting and equipment maintenance, interpretation and judgment. So all this comes into play. Calibration, quality control, proficiency testing materials, test system, troubleshooting, equipment maintenance, interpretation and judgment. The vision of the accreditation process. So it starts with application, then your application that goes in between. It says what optional education modules, etc. Then your application is accepted by CAP. On-site accreditation assessment can be done. To start the process of accreditation, it splits up into 2, as you can see, and it at least takes a year for the final assessment and auditors to come through. Standards. The 4 standards of accreditation in this document constitute the core principles of College of American Pathologists Laboratory Accreditation Program. The objective of the standard is to ensure that the accredited clinical laboratories meet the needs of patients, physicians, and other healthcare practitioners. The CAP accredits clinical laboratories that conform to the standards. The specifics of how the standards are applied to the laboratories are found in the CAP accreditation checklist and terms of accreditation. So there's a lot of paperwork that you and we all have to read up and understand. And you can bring them up and ask them, they will guide you. CAP has 4 main standards to be followed. One is director and personnel, very important. Then you've got the physical resources that your lab has. You've got quality management. And number 4 is administrative requirements. So you can see that it's like running a firm. You have to have all 4 in place, from director to the physical resources, quality management, and administrative requirements. So you have to have people trained in this. Standard 1, director and personnel. A board certified pathologist or other qualified physician or scientist with doctoral level or commensurate qualifications that meet or exceed requirements of applicable law shall direct the laboratory service, and that is very important. The director must be qualified to assume professional, scientific, consultative, organizational, administrative, and educational responsibilities for the service provided. So here you have to have a person, male or female, which is very, very well equipped and qualified. The director is responsible for maintaining the standards and implementing the requirements of accreditation checklists and documenting compliance. The director must have the authority to fulfill these responsibilities effectively. So if you have somebody who cannot do this, then there is going to be a problem. The laboratory shall be staffed with sufficient number of personnel to perform quality laboratory testing. So they have to be trained. The laboratory shall be organized to ensure that the director's responsibilities are fulfilled. Lines of authority within the laboratory are defined, and individuals who work with the laboratory fulfill their responsibilities and interact effectively with each other. So the cohesiveness of the staff and the training of the staff has to be perfect. Second stand, physical resources. There shall be sufficient resources to support the activities of the laboratory. So here you have a picture of a lab, a well-equipped lab. Such resources include but are not limited to physical space, testing instruments, reagents, information processing, and communication systems, ventilation, storage and waste disposal facilities, and public utilities. So everything has to be looked into. Patients, laboratory personnel, and visitors shall be protected from hazardous conditions. So the patients, collection center, everything, reception has to be outside. Reasonable accommodation shall be made for disabled persons. So you have to look after them especially if they're wheelchair bound, etc. Number 3 is quality management. The laboratory shall have policies and procedures to ensure quality laboratory testing and patient safety. These requirements include but are not limited to validation of test systems, analytical quality control, quality management of pre and post analytical processes, proficiency testing or periodic alternative assessments for laboratories test performance, human resource management, HR, information management, ongoing quality improvement, and appropriate communications to clinicians, patients, administration, and government amenities. So this is, I told you, it's a well organized management laboratory and system. So here you go, you've got in the middle, you've got quality management, and see what it is made up of. I'll start with quality metrics, SOPs, process reviews, monitoring, oversight, regulatory requirements are met, audits and inspections, again very important, and the training. And it's a roundabout process. It keeps going round and round till you know what's fine. And you've got the 4 most important checks. You've got plan, do, act and check, PDAC, 4-step management method, which we use in manufacture also. Number 4, administrative requirements. CAP accredited laboratories must comply with the requirements specified in the accreditation process. Checklists and terms of accreditation. What do they involve? These requirements include but are not limited to on-site inspections, interim inspections, interim self-assessment, maintenance of appropriate records and documentation, cooperation with laboratory accreditation program, and adherence to its policies. So it has to be a very, very fluid intake between the two. Now you've got enhancements. CAP accreditation is now easier and quicker than ever before, as 6 new changes have been introduced. Now, keep that in mind. Integration of new technologies. To advance standardized practice in genomic testing, CAP has introduced a new section to molecular pathology checklist to address next generation sequencing, whole genomic sequencing. As a result, this checklist has been reorganized and slightly renumbered to facilitate a more logical and efficient flow. The clinical biochemical genetic checklist was added in 2011 for laboratories providing clinical biochemical genetic testing for the diagnosis and management of patients with inborn errors of metabolism. So this is something new, a whole new dimension was added in 2011. Globalization of the checklist. To accommodate international markets, checklists are now customized to exclude requirements only applicable or required by US agencies. This new change will make compliance easier regardless of laboratory size, while facilitating standardization across global laboratories for international reference laboratories and academic medical centers. So now this is again something that they've introduced, which makes the life of the international people, labs, easier. Further elimination of redundancy. To minimize preparation time, requirements no longer relevant are duplicative or rarely cited when eliminated without measurable effects on CAP's decision to accredit the laboratory. Now this is between them and the lab, right? To customize laboratory general checklist. To tailor your laboratory general checklist to your laboratories, simply update your laboratory experience a shorter laboratory general checklist for your next on-site and self-inspection. All right, they're giving you that leeway. Generous requirements. The requirement for have become agency neutral. Reference to outside agencies has become more generalized. Example, a requirement about Health Information Probability and Accountability Act, requiring protection of patients' healthcare information, would have been renamed to a requirement about patient confidentiality. All right. Annotate checklists in MS Excel. You can download your checklist in Excel to make laboratory preparation more efficient. Question mark. Introduced in 2011, you can simply download to Excel through eLab solutions, and again this is one of the documents. Annotate and index your laboratory's policies, procedures and records. Improve your document control and enjoy the efficiencies gained on your inspection day. Now again, this is a checklist, a design of the checklist, and you can see there are various headings. We'll give you a minute to go through it. So you have a yes, no, you have comment, person responsible, due dates, and so on. Take a look. All right. New services, CAP accreditation for biorepositories. The biorepository accreditation checklist includes requirements to drive biospecimen quality and promote standardization. The CAP biorepository accreditation program provides confidence to biorepositories to deliver high quality biospecimens needed to support research and personalized medicine and to improve patient outcomes. Then something new that we introduced. This program is tailored to biorepositories storing tissue for non-transplant related research. The new CAP accreditation manager. Again, you have a document here. Through a partnership with SoftTech Health, CAP introduces CAP Accreditation Manager, new software with streamlined accreditation, document control, and the regulatory compliance processes in the laboratory. This advanced time-saving laboratory software tool provides a better way to efficiently manage laboratory resources that maintain so this is given us data. We've got imaging, tissue biospecimens, blood biospecimens, we've got clinical trials, and you've got research support specimens as well. All common checklists. The all common checklist created in 2011 to standardize and streamline the accreditation process has been expanded to 2012. And I think now it has gone further. Applicable questions with regard to quality management, reagents, collection manuals, instrumentation, valuation, and review of unusual laboratory reports have been moved from individual discipline specific checklists to all common checklists. This checklist remains a consolidated set of requirements that are similar or identical across multiple disciplines. Features a reduction in the number of requirements. Laboratories will experience a decrease in preparation time and response to deficiencies that may exist in multiple sections. So they've toned down to what is required. The inspector's findings referred to as Inspector's Summation Report, ISR, will continue to be left with a laboratory after inspection. Deficiencies cited in all common checklists will be recorded in reference to the discipline where a deficiency occurred. For example, the deficiency cited for all common checklists used to inspect hematology will be listed on the hematology deficiency page. A reduction in laboratory preparation time in meeting document control guidelines, an overall reduction in the number of requirements and possible citations per section. So they've trimmed it down and made it very, very slim and exciting. So the inspector's finding, referred to as Inspector's Summation Report, ISR, will continue to be left with the laboratory for after inspection. Deficiencies cited in all common checklists will be recorded in the reference to the discipline where the deficiency occurred. For example, a deficiency cited in the all common checklist used to inspect hematology will be listed on the hematology deficiency page. This is a little bit of a repeat. A reduction in the laboratory preparation time in meeting document control guidelines. An overall reduction in the number of requirements and possible citations per section. They've trimmed it down. They've made it lean. Reorganization benefits include a reduction in laboratory preparation time in meeting document control guidelines, an overall reduction in the number of requirements and possible citations per section. Laboratory section units that previously had one discipline-specific checklist per section unit department will now receive 2 checklists per section unit department. You have the all common checklist. You also have the discipline-specific checklist, hematology, biochemistry, and so on. And section units, departments with multiple discipline-specific checklists per section, unit, department, example biochemistry, hematology checklist, in one core laboratory. Common requirements will be grouped together in all common checklists. The results in a net reduction in checklist requirements. Since the requirement that formerly were duplicated in chemistry and hematology, checklists have been deleted to replace an all common checklist. In conclusion, if you follow their regulations and their requirements, When a lab gets its accreditation, especially a CAP accreditation, it's success. It's success that came from team effort and due to diligence. You have every right to enjoy that moment. So it's a team effort, it's a group effort. Everybody has to work together, train together, and know what is happening. Thank you. That's the end. All right, guys? Quite intense, isn't it? Any questions? Farizad, Meena, Dr. Chogle?
Ma'am, once it is you get the CAP accreditation, then ma'am, it has some expiry date, like every year you have to, it's just a continuous process.
It's a continuous process. They will come to you. You have to undergo this every 2 years, and in between there will be a small examination, like NABL has. It's a continuous process. You can't say, "Oh, I've got my CAP and I'm not going to look after anything." They've got all these rules and requirements, and you have to go through the ICWAS, the everyday's quality control, the trainings, and so on. NABL is the same way. You just can't rest on your laurels. So now you've got NABL, nothing will happen. It's an ongoing process, as is CAP, and CAP is more intensive. Meena, have you understood what we're trying to tell you?
Yes, ma'am. Yes, ma'am. Yeah. I was just thinking, like every year or 2 years.
Every 2 years. They come to you every 2 years, and then after a year they have another small exam. Farizad, any questions?
I was a little confused with that overall that checklist. There's no repetition. I didn't quite get that. What were they trying to explain? That means earlier something was repeated. I didn't get that part.
See, now this checklist is more streamlined. So you have to follow the checklist as to what they ask for. So previously there was duplication. What was asked in biochemistry was asked in hematology, was asked in immunology. Now it is all streamlined. Now you have to see the checklist, study it and absorb it. You and me talking like this, maybe you will not understand. So that's what I'm saying, they were duplicated. This checklist, that checklist, now it's all one. You got it?
Thank you, ma'am.
And I can tell you it was really very cumbersome, the way it was. At 2011, 2012, they've changed quite a few, and I think again they've changed quite a few many things. Because we in India, you have to be very, very careful. You could talk to them anytime, you can email them, they will guide you. Dr. Chogle, any inputs from you? Do they have any input? Dr. Chogle? Hello?
As I told you last time, that this is something very new to me, and I was unfortunate to learn these points of CAP accreditation. So when I don't have that much knowledge, I think I should not talk.
So they have a lot of training programs all over which you can attend. Just for the sake of interest.
Yeah.
Alright, so can we end here today? Right? Alright?
Okay, thank you.
Right. Thank you.
ma'am.
See you.
Thank you, ma'am.
And we've got another oddball of a topic, blood gases. Maybe Dr. Shubha Chogle will be able to tell you more about it. Okay? So she used to teach this to our students.
Yes.
Righto? We'll see you next Thursday.
Yes, ma'am.
Okay.
Looking forward.
Right. Keep well. God bless.
Thank you.
Right.
Thank you.
Thank you.
Thank you. Thank you.
हो गया? भेज दिया उसको? पास तो है ना.